Elsie Fossum died from injuries she sustained at Claremont Place, an assisted living facility in Pomona.
That's really a good one.
Yeah.
7 years later, her nephew, Jim Fossum, says the family is still waiting to hear from investigators at California's Department of Public Health how his aunt died.
It was being investigated by the department. You figure they're going to find something if there was something there. Not that they just put the thing away and forget about it, essentially.
The facility initially told the family that Elsie died from injuries she got when she fell down.
That wasn't a result of a fall. That was punching.
Beverly McPherson is the former nursing director at Claremont Place, and she visited Fossum in the hospital.
Her face looked like Muhammad Ali did a dance on it, and you could see knuckles. Her eyes were so badly swollen and just hanging, and she was miserable. It was very sad to see.
McPherson believes that the nursing assistant who worked the night shift beat the elderly patient in her care. Elsie Fossum died less than 3 weeks later from her injuries. Claremont Place declined to comment for this story. The coroner's report concluded she was potentially the victim of an assault, but despite evidence pointing to a crime, the Department of Public Health's investigators sat on the case. Yearly investigation totals obtained by the Center for Investigative Reporting from the Department of Public Health show there was a steady increase in outstanding complaint cases at the time Fossum died, and that backlog was especially severe in Southern California, where she lived. Documents show state regulators effectively shelved more than 900 cases from Southern California, including the most alarming allegations that involve suspicious deaths. Elsie Fossum was among those cases. Mark Parker believes that's because some investigators weren't doing their jobs. Parker worked at the department for 24 years, and he oversaw investigations at the time of Elsie's death. He inspected the Southern California office and says what he found was chaos.
I was appalled. There were hundreds and hundreds and hundreds of unassigned, uninvestigated complaints in file drawers.
Then, Parker says his superiors at the department pressured him and his investigators to close cases quickly and efficiently. They were ordered to wrap up at least 10 cases a month. Dr. Ron Chapman took over the Department of Public Health in 2011. He admits the department's investigation section was poorly managed, but he says now they're making changes.
And a backlog for investigating complaints is inexcusable. It should not have occurred. We've made a lot of progress since then. So today, any complaints that come in, they're being screened within 48 hours, and we're not building a backlog today.
The data shows the Department of Public Health has reduced their backlog in record time. But former Chief Investigator Mark Parker says the new policy discourages investigators from visiting the scene of potential crimes. Instead, investigators do most of their work over the phone.
If you don't go eyes on, interview people directly, talk to people directly, you're going to miss huge amounts of information, and that places the public at risk.
The department's own data shows that even though investigators are closing more abuse cases, they're rarely taking further action. The department is revoking far fewer caregivers' licenses, and they're referring fewer cases to the Department of Justice for prosecution. The department defends its policy, but Dr. Chapman admits he's troubled that fewer cases are being referred for legal action.
We don't understand that decline in numbers. It's very concerning to me, and we're looking into it.
That's little comfort to the family of Elsie Fossum. Her case was lost in a pileup of healthcare abuse cases at the Department of Public Health. Her case was passed through different state agencies, even the local police. But no charges were ever brought. Despite questions surrounding her death, the Department of Public Health closed her case in February, 7 years after she died. In an email, the department admits it should have identified this allegation as a high priority and says, "We regret that did not happen." Dr. Chapman says he'll personally be looking into Elsie's case.
We should be doing investigations on all complaints. If that's not occurring, that's a problem, and we need to address it. And I'll be looking into that case, absolutely.
Elsie's nephew, Jim Fossum, hopes that the agency will step up and investigate abuse cases thoroughly, not only for his aunt, but for everyone.
You know, as we baby boomers get older, there's more and more people that are going to be living in these types of facilities, and you gotta have decent agencies that monitor these situations.